Welcome to Season 4 of My Wife the Dietitian, a fun, evidence-based weekly podcast about nutrition and healthy living. On today's show, we're talking about Ozempic teeth, a side effect from the medication that is becoming more and more prevalent. Stay tuned to hear how these medications affect oral health. Enjoying the show? You can help others find it and enjoy it too by giving us a 5-star rating or review. If you feel like reaching out to us with a question or comment, you can send us an email at mywifetherd@gmail.com. And don't forget to visit our website at mywifethedietitian.com, as well as our social media pages. We're on Facebook, Instagram, and YouTube. Enjoy the show. Welcome to My Wife the Dietitian. Hello, Sandra.
Hi, Rob.
How are you?
I'm okay. How are you?
I'm great.
Good.
A little tired.
A little tired.
It's hot out.
It
makes
is.
you tired. Summer's busy too. You get worn out. Like, I think this happens to me every year, but it's just like, oh man, I'm just like, I need a vacation from my vacation.
Lucky you.
Yeah. Life is busy, but good.
Yeah.
So there's a long-winded answer to your question.
Well, do you remember we interviewed Dr. Dean Elbe, pharmacist?
I remember.
Yeah, twice now,
Ask
actually.
the Pharmacist.
Ask the Pharmacist.
Yeah.
Episode 178 was an episode with Dean, and he just wrote an article on his drugnutritioninteractions.com website, and it just sparked curiosity for me, and I think this is it's an interesting emerging thing. And have you heard of Ozempic face?
Ozempic face. Is that like a side effect of Ozempic?
It is.
Oh, okay. No, I haven't heard of that.
Yeah, it's one that it's kind of out there trending in terms of, more and more people are taking the weight loss medication Ozempic. And we have other episodes that we've talked to Anna Reisdorf, dietitian from the GLP-1 Hub. And that was episode 180. And she was talking all about Ozempic and pros and cons. And then we also talked to Rhonda Krick, dietitian, episode 152, Ozempic and weight loss. And the Ozempic face, it's like, sounds kind of like a...
It sounds a little derogatory.
Oh, absolutely. Yeah.
Yeah. And is it specifically Ozempic, or is it just like any GLP-1 medication?
Yeah, it is. And GLP-1 antagonist medication. You're right. Yes.
So it's GLP-1 face.
Yeah. But I mean, I think people don't necessarily know what GLP-1 antagonists are, but they know what Ozempic is, or they've heard the term Ozempic.
It's like the Kleenex of the GLP-1s.
Yeah, exactly. That's right. Yeah, and what happens with the Ozempic face, and we haven't even talked about what we're talking about today, but Ozempic face is just the rapid weight loss, so the fat and muscle loss can affect your cheeks, like it's sunken cheeks, and it affects different areas of lean like muscle mass.
Facial structure kind of.
Yeah, exactly.
Wow, interesting.
Yeah, and the same thing, Ozempic butt is another term, just
Ozempic butt.
The flat behind.
Yeah.
But we're going to talk about Ozempic teeth.
Those things happen when you age too, hey?
Yeah, exactly.
Interesting.
Well, and that's kind of what, for some of what I've been reading and hearing about, like the Ozempic face in particular, it actually can affect people's appearance and make them look older than they are.
Oh, wow.
Because the puffy cheeks, kind of the rounded face, can actually give your face some youthfulness. So that's just something to consider. If you're thinking about taking these GLP-1 antagonists or the Ozempic or other ones, it could change, it's changing your appearance, and your facial structure and how your face appears could be part of that. But teeth too. Now this is more of a kind of nutrition related concern, side effect, and can affect more than just your appearance. I mean, definitely teeth are a big part of your smile and your appearance, but it can also affect your oral function and how you're able to chew and swallow effectively.
Right. Okay.
So yeah, Ozempic teeth. And there's an article that Dean Elbe just put out on his website. I'm going to link it in the show notes. It's in drugnutritioninteractions.com, and it was from July 28th. And just the little prelogue, it says the popularity of GLP-1 antagonists like semaglutide, Ozempic, or Wegovy, and Mounjaro or Zepbound for weight management continues to soar, but a lesser-known side effect is emerging. Ozempic teeth. Patients are reporting increased dental issues, including dry mouth, tooth sensitivity, and even tooth loss. So obesity medicine specialists emphasize that dehydration and reduced saliva flow may be contributing factors accelerating decay and gum disease.
I guess those are more long-term. I mean, like, it's something you're not going to notice for probably quite a few months if you're taking Ozempic.
Yeah, exactly. It is interesting. Like, we've talked a little bit about side effects in other with other guests, and one side effect could be nausea. So it's usually the first 4 to 5 weeks the nausea can be common, and maybe for some people it subsides within about 8 days. But nausea can also affect your mouth and ripple effects for your teeth. So nausea, especially if you vomit, because that, creates acid in your mouth, and then that can start to eat away at the enamel in the teeth. So that's part of the problem. But about 5 to 9% of the people taking the GLP-1 antagonists have vomiting. So it's not everybody at all,
right?
But it could be a factor, and that's one aspect of the Ozempic teeth. But there's other things that happen too. So the dry mouth is a big reason that people start to have changes to their teeth.
Because I'm guessing there's a purpose to having like saliva and having your mouth wet, right? Like it keeps things flowing is what moisture usually does, right? Because if it's dry, then things can sort of settle and they don't get washed away and then they eat away. Is that kind of where you're going with the dry mouth thing?
Yeah,
okay,
absolutely.
I can see that.
Yeah, like you think of a river flowing, and if there's lots of fluid, and we've talked about, we're going to link some of the episodes we've done about how much water to drink, hydrating foods, keeping your level of fluid intake up, because that is going to help with hydration. And if you think of a river drying up, well, the same thing in your mouth. Like if you just don't have that saliva production, it can, things just get sticky. You get dry mouth. You can get cracked teeth. You can start to have enamel erosion. There's a lot of kind of ripple effects with the dry mouth. And what happens is the saliva production can decrease with the GLP-1 use.
Okay. Right.
Because there's a physiological mechanism happening. So the GLP-1 meds affect the way the food flows through the GI tract. We've talked about that before. So like basically at the end of the day, people just they lose their appetite,
right? Or
their appetite goes down. Like most of the people, like that's why it works.
Right, because they're not eating as much.
Yeah, because their appetite is less. So what happens, though, is it's slowing the rate at which food leaves the stomach. And so it's called delayed gastric emptying. So if things aren't flowing down...
And you feel full longer, so then you don't eat.
Exactly. And the saliva production, because if everything's kind of slowed down, your stomach emptying has slowed down, it reduces the appetite, and then it alters your gut-brain signaling. So your body doesn't think there's food coming, and you're not really eating that much. So there's no saliva stimulation.
Right.
And production.
It's not needed.
Yeah.
Gotcha.
Exactly. Yeah. And it's something that we see with helping people who are going through cancer treatment, and if they're having systemic therapy or chemotherapy that's affecting their, they get dry mouth or xerostoma. Xerostoma is another word for it. Zerostoma. Xerostoma means dry mouth.
Right.
So it's really important for people to think about hydration and making sure they're, eating hydrating foods, because this dry mouth can really lead to other problems like cracked lips and dry lips, sticky saliva, trouble swallowing. There's things that can aggravate this, like alcohol, tobacco, caffeine can all make your mouth more dry. It can also affect your gums, and you could get inflamed gums. So there's a lot of aspects to this, and it's really important that people know if they're going to take the Ozempic or other types of medications, the GLP-1 antagonists, that they can be proactive and make sure they're getting enough hydration, that they're getting enough nutrients, because I think there is this potential for malnutrition because you're just not eating. You don't have the appetite, so you just aren't getting what your body needs in terms of nutrients.
Okay.
Right?
Is there any data there that indicates how many people are having issues, like the dental kind of oral health issues? It's
something that's emerging, like as more and more, as Dean was saying in our interview, how he said, like, as the amount of people that are taking it is growing, then we're going to see different side effects because the number's growing. Mm-hmm. So then we can see what's happening. And as you mentioned, it's probably more of a long-term side effect.
Right. It's something that's going to evolve over time.
Yeah. And especially if you're not getting enough nutrition, so you're malnourished, like you're not eating enough. And if you aren't drinking enough fluid or eating hydrating foods. And that's the treatment. That's what I would say the take-home message is try to make sure you're getting enough fluids through the day. So as I mentioned another time, we lose about 10 cups of fluid every day. So you should make sure you're getting, 10 cups of non-caffeinated, non-alcoholic fluid over the day. Definitely oral hygiene. So flossing and brushing, that's really key, like brushing at least twice a day, flossing at least once. I know a lot of people don't floss, but you floss before you brush. If there's an issue with any of those things, it's really important to brush before bedtime so that you can clean your mouth out and clean your teeth so you don't have the bacteria sitting there, overnight and causing problems.
It sounds to me like the medications, the GLP-1 medications, aren't the issue, but they cause side effects that create the oral health issues. Mm-hmm. Right? Like the dehydration, or not dehydration. Well, I guess it's you're not getting enough fluids. You're not getting enough hydration. You're not moving things around because your saliva production is slowed. And so it's interesting to be aware of those things for sure.
Oh, yeah, absolutely. And just the fact that if you want to prevent dental cavities and tooth loss, decay, all of these things can, and even inflamed gums can all be related to the dry mouth, the symptoms of dry mouth.
Right. Okay.
So it's important for you to have proactive, dental appointments, connect with your dentist, your dental hygienist, and proper oral hygiene, and also just connecting with the healthcare providers, like a dietitian. Like if you are on a weight loss medication, I think it's really important that you are making sure you're getting your nutrition, because it's harder when you don't have much of an appetite. I mean, this is, my whole career working in oncology nutrition and helping people that don't have an appetite through cancer treatment. It's difficult. And if Ozempic is causing you to lose your appetite so that you're not eating as much, you really have to maximize what you do eat so that it's nutrient rich. You're eating really well, when you are eating, because it's such an important aspect, and making sure you're getting those vitamins and minerals that are key for your nutrition. So vitamin C, vitamin D, and B are all important for gum health. So that will help keep your gums healthy. And then, of course, calcium and vitamin D are important for the structure for your bone health and your actual tooth enamel and your tooth health. So the vitamin D helps your body absorb the calcium out of the gut, and that all helps to work together to make your bones strong, and including your teeth. So, I'm sure we're going to hear about Ozempic osteoporosis eventually, because, there's so many ripple effects if you're not getting the nutrients that your body needs for the long term. So, I just wanted to bring that up, and we're going to link those episodes and Dean's article in the show notes. Plus, there's another article on the GLP-1 hub, Anna Reisdorf's, that a dietitian, Sydney Lapp, had written about the GLP-1 side effects. So that would be it will help you do a little bit more deep dive into the different side effects that you should look into. Yeah,
it's good to know things with whatever you're getting yourself into, with whether it's, like different medications, different diets, there's side effects with everything. There's pros and cons. So do your homework and, Yeah, so the take-home message would basically be trying to stay hydrated. At least 10 cups a day would be a good idea. Water on the plate. Remember we talked about that? So wet foods. Yeah. Well, that sounds like cat food, but... Yeah, more like non-starchy veggies. So if you can aim for, 5 cups a day, like with your lunch and your dinner, maybe your snacks, breakfast with your eggs and spinach and different vegetables with eggs, or berries with your oatmeal, or however you do that. Making sure that you're maintaining your good oral hygiene with flossing and brushing, getting your cleanings and checkups, making sure, if you like gum, chew sugarless gum. That actually helps with saliva stimulation, and it actually helps with protecting the enamel. And 3 out of 5 dentists recommend it. Right. I wonder what the other 2 recommend. No one ever talks about them. That's funny. Awesome. Well, thanks for sharing that. Is there any more, or is that it? We didn't mention, but with, reduced saliva, you can have increased risk of gingivitis with the plaque accumulation. Plus the, as I mentioned, how the river can, with a riverbed that dries up, the same thing with your mouth. So if you have not enough fluid in your mouth, it's uncomfortable, but it actually increases bacterial growth, and it increases your bad breath. So and then that can lead to tooth decay. So maybe the dentists are going to be seeing more and more people that are having issues because they're on the Ozempic and GLP-1. Yeah, it'll be interesting to see how it all pans out. If it'll be a wave of new kind of referrals and patients. Yeah. Well, thanks for sharing that. That's good information to know. And like we said, make sure you do your homework before you jump into these things. If you want more great information, check out our website. It's mywifethedietitian.com. We've got a great blog on there, all sorts of different links, and we have a weekly newsletter you can join that has all sorts of great information in it. That's free to join. If you have questions for us, or if you have questions for Dean, our resident pharmacist here on the show, Ask the Pharmacist, let us know. You can email us those questions to mywifetherd@gmail.com. We'll be doing another installment with Dean in the next month or so. So let us know what's on your mind. You can also find us on Facebook, Instagram, and YouTube. Feel free to reach out to us there as well and leave your comments. We love hearing your feedback. And if you like the show, let us know. You can rate and review. Like I said, comments are super helpful as well. Sharing with your friends is also super helpful. It would be much appreciated. And that is it for this week. We will be back, well, not this week. We'll be back on Wednesday with Nutrition Nuggets, our midweek mini episode. So until then, have a fantastic week, everyone. Thanks for joining us today on My Wife the Dietitian. If you like what you heard, don't be shy. Leave us a comment or review, and be sure to share our podcast with your friends. If you'd like to hear more, hit that subscribe button. You can also follow us on our social media pages for updates, episode trailers, and other odds and ends. For more info and links on what we discussed on today's episode, check the show notes. We'll be back next week with another informative and fun-filled episode.